In today's short video, I'm going to discuss the tooth-colored fillings known in the dental profession as composite resin restorations. Stick around. Well, hello again everyone, and welcome back to another video on Dentistry Made Simple. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. In a previous video, I talked about the silver fillings that many of us, over a certain age at least, likely have or had in our mouths. But today, I want to turn our attention to the tooth-colored filling material that has gained tremendous popularity in restoring small to mid-sized cavities in teeth, and that material is called composite. So what is a composite? Well, the formal definition of composite is a combination of two materials with different physical and chemical properties that, when combined, create a material specialized to do a certain job. Okay, thanks, Doc. That's fascinating, but who cares? Well, composites are more common than you might realize. They're all over the place, actually. Some good examples that are quite familiar to all of us include fiberglass, often used in boats, carbon fiber, used in planes and automobiles, and plywood, believe it or not. In dentistry, composites are primarily made up of plastic and powdered glass. The plastic gives composites their strength, and the glass gives composites their lifelike appearance and polishability. In this age of cosmetics and aesthetics, the use of composites in dentistry is huge. So let's go over some of the many advantages of dental composites, as well as some of the things you need to be aware of. Okay, first the advantages. Number one is obviously the aesthetics of the material. Back in the early days of composites, the number of shades or colors that were available were limited. So you picked the closest one and went with it. Today, the number of shades is so numerous that these materials literally disappear to the point of being practically invisible, where even the trained eye of a dentist would have trouble spotting these fillings. I think that's awesome. Number two, composites are actually bonded or glued to the tooth, if you will, to the point where it can actually give the tooth additional strength. Pretty sweet. Number three, because this material is bonded to the tooth, it means less drilling is required, so less natural tooth structure needs to be removed in order to restore the tooth. I mean, come on people, who isn't a fan of less drilling, am I right? Number four, again, because of the bonding, composites can be easily repaired if damaged. New composite will stick to old composite. Number five, you can start eating on these restorations immediately, at least once the numbness from the shot wears off. And number six, composites are ideal to fix small chips in teeth, cavities that would otherwise be visible when you talk or smile, and for replacing silver fillings. In terms of the disadvantages, thankfully these aren't serious, but you need to know that, number one, the lifespan of these restorations are about 5 to 7 years on average, which is less than some of the other cosmetic materials such as porcelains, for example. Number two, the placement of composites is very technique sensitive for your dentist, meaning there is a very regimented sequence of steps that need to be followed carefully to ensure success. Otherwise, sensitivity can result, which typically resolves on its own, but if not, it means another trip back to the dentist to correct it. Number three, because they require more time to place in the mouth, they're going to cost more than silver fillings, but well worth it in my opinion. Number four, you, the patient, really need to practice meticulous oral hygiene to prevent any new cavities from forming around these fillings. Number five, although these fillings are pretty strong, they tend to be less successful in areas where you use a lot of biting force, such as your back teeth. And lastly, number six, if you're a heavy coffee or red wine drinker, you need to know that these restorations will stain over time, requiring replacement more often. Well, there you have it, folks. A truly excellent material yielding beautiful results. That's a win-win for everyone in my book. So let's wrap up this video today. I hope you learned something that you didn't know before. If you liked this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Please consider subscribing and be sure to hit the bell icon so you can be notified of future educational videos on Dentistry Made Simple. Bye-bye.